Hello, this is Dr. Ford Brewer with state-of-the-art heart attack, stroke, and cancer prevention. People have asked, what is a visit like for heart attack and stroke prevention? So that's what this video is going to be like. What happens when you get an evaluation and treatment to prevent heart attack and stroke? Well, first of all, let me just say that we use the protocol developed by Bradley Bale and Bale Doneen. It's a wonderful protocol, and it's focused on something that's not really seen very much in today's medical world. Number one, looking at inflammation is the real cause of imminent heart attack and stroke risk. Find that plaque, find inflammation, and get rid of that while you help the patient deal with root causes like obesity, insulin resistance, and things like that. So how does the process work? Well, first we get a thing called a CIMT, Carotid Intima Media Test. It's an ultrasound of the carotid artery, and it basically, again, doesn't look at flow, because the other studies like stress tests and carotid flow studies wait until you get 50% occlusion or more. As you see, that's way too much occlusion. You start getting plaque all the way back up in here. The Carotid Intima Media Test, CIMT, that we order for you will show this plaque in early stages so we can start treating it and keep you from getting down to where you have lesions as bad as occlusion or loss of flow. Again, now this artery has plaque all the way from there to there, but it still would show up just fine on a stress test or a carotid ultrasound. What's worse is this artery has inflamed plaque, as shown right here, and that inflammation, if it breaks through this intima layer and touches the blood, will cause a clot. It's not that waxy substance of plaque here that causes the heart attack and stroke. It's the clot caused by hot or inflamed plaque reaching the bloodstream. Then we order a battery of tests, a panel to look at whether or not there's inflammation. Actually, the enzymes involved in cardiovascular inflammation can be detected in the blood. Enzymes like myeloperoxidase or MPO, plaque 2, and the microalbumin-creatinine ratio, which is a comparison of protein in the blood and urine, can tell us whether or not you have damage to the lining of the arteries. We also look at cholesterol tests for obvious reasons, a full panel there, as well as other metabolic panels, because we want to know things about root causes. Remember, one of our most common root causes is insulin resistance or pre-diabetes, especially in the patient population in the 50s, 60s, and 70s. Other common causes are dental infections, dental problems, sleep dysfunctions, and Lp(a). So when you get your tests back, we'll go over with them with you with the documentation, which helps you understand much more clearly what the labs mean. It's not the old style labs, which have a bunch of numbers and are very difficult to understand and can actually be alarming. In fact, we have about a quarter of our patients will elect to do this evaluation by telemedicine. We'll set up the evaluation. We'll set up the labs, and we'll set up the CIMT. So we sit for a couple hours and go over all that information. How about treatment? Yeah, the most important treatments are lifestyle, weight loss, proper diet, proper exercise. But for some people, medications are needed, and yes, we provide medications as well. I'm licensed in over 30 states and have a lot of experience in telemedicine, so I know all the regulations and ethics and appropriate care for telemedicine. we provide that as well, but only if you're currently located in one of those 30-something states. You can always come see us in our headquarters and home office in Nashville as well. So again, just a repetition on the process. We look for disease using CIMT. We look for the plaque. The CIMT, if it shows plaque, can also show whether it's soft or inflamed. Lab and urine tests, blood and urine tests, can tell us whether or not you have inflammation as well. They can confirm that. If you have plaque and you have inflammation, then we start helping you understand what your root causes are. Sometimes we need to give you medications for that inflammation. Quite often, the most two common drug classes for that are the statins and the ACE inhibitors. We have a lot of people who are very nervous about going on statins, and we go through the whole benefit-risk equation on that, and quite often there's several visits involved before a patient decides, you know what, I probably need to take medication too. So thank you again. Heart attack and stroke prevention.